Meeting law requires that I notify the public that this meeting is being recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made by Boston City TV, a part of the City of Boston Office of Cable Communications, and is being broadcast on Xfinity Channel 24, RCN Channel 13, and FiOS Channel 962. And now I hand it over to Jerry.
Thank you, Jessica. And yes, I'd like to call to order this month's meeting of the Disability Commission Advisory Board, our last meeting for 2020. And now I'd like introductions, and Jessica's going to help facilitate that, actually. So.
All right, so we're going to try something new today. We're going to try that I'm going to call on people based on the order that I see them on my lovely screen. So that means we're going to start with Ducia.
All right, good evening, everybody. My name is Ducia Lebovskaya, and I'm a board member, and I'm in the Boston Mission Hill specifically. Thank you.
Wonderful, thank you, Ducia. Next, can we have Wesley?
Hello, my name is Wes Ireland here. I'm signing and speaking to you through an interpreter today who is voicing for me. I'm a board member and I live in the North End. Thank you so much.
Thank you, Wes. And now can we have Olivia?
I am Olivia Richard. I am a board member and I live in Brighton.
Great, thank you, Olivia. I believe now, can we go to Kyle?
Hi, my name is Kyle, also a board member, and I live in Lower Roxbury.
Great, next we have Elizabeth.
Hello, I'm Elizabeth Jean Clower, Vice Chair of the Board, and I live in the Back Bay.
Wonderful. Next, can we have Juan Carlos?
Everyone, my name is Juan Carlos Ramirez, board member, and I live in Boston South End.
Great. Now I believe we have Paul on the phone. Paul, you'll need to unmute yourself. Paul, you're currently on the phone and you're muted. All right, Jerry, that went as smooth as possible. We'll just have to note that Paul Karen is on the phone. And also we have Carl.
Oh, Carl.
Hi, this is Carl Richardson from Brighton, and I'm a commission member.
Great. And once again, I'm Jerry Boyd, and I am from West Roxbury. Next, we have City Department presentation, and I've already forgotten the full name of the office. You'll have to forgive me. The Office of Energy, Open Space, and I forgot the third name. I apologize. We have Aiden Smith leading that presentation.
Yes?
Great. So yeah, thank you so much. My name is Aiden Smith. I am an outreach coordinator with the City of Boston's Environment Department. And thanks to Jessica for inviting me to speak to you all this evening. I have a few slides that I want to share. So let me just get that up for folks. Okay. Is everyone able to see this?
Yeah, I can see it.
It's coming through. Great. So, all right. So yeah, I'm here just to talk, I think, for about 10 minutes on a new program coming out of the city of Boston.
Aiden, can I pause you just for a moment? I just want you to know that your speaker notes and your timer are also on the screen.
Oh, okay. Speaker notes are not so important. Okay.
If you'd like,
How
Aiden, I
about
can
now?
also. Oh, perfect.
Is that better?
That's great.
I use Zoom, so I'm less familiar with this format. Okay, so yeah, I'm here to speak about Community Choice Electricity, a new program coming to the city of Boston. At a very general level, this program is about allowing the city of Boston to pool the collective buying power of Boston's residents and businesses to negotiate favorable contracts with electricity suppliers. It allows the city to work on your behalf to provide affordable and renewable electricity. And so on this slide, I've also put a disclaimer from the Department of Public Utilities. They require that I do mention that we cannot guarantee savings through the program, but we will strive to provide both affordable rates and stable electric rates. And on the slide, I also have an image of kind of some art we had created for the program, basically showing that one of the ideas of the program is that we're stronger together, we're stronger as a community. So this program, like I said, is only really deals with energy and specifically electricity supply. But it's a pretty major shift in how we procure electricity, both as a city, but also for residents and businesses. If we start on the rightmost side of this image, this diagram, I've shown a little blue house that is the electric customer, that's us. And we all know we get our electricity from Eversource, which is the local utility, as indicated by the green dots or electrons flowing to your home or business. But what I'm trying to show here is that Eversource, while they're the utility, they need to get their electricity supply from somewhere. And so one place, at the top I'm showing Eversource. They are the utility, but they can also procure their own electricity. And so if you're a customer, you can get your electricity supply from Eversource. You can get your electricity supply from an electric supplier. But in yellow here is shown, now you can get your electricity supply from the City of Boston's Community Choice Electricity Program. So it's a whole new way to get electricity. So that's what's being shown here. There are 5 key things to know about this program. The first two we've already spoken about. So the first being it harnesses our collective buying power as a city. The second is it provides greater local control over the decision-making process. This is really about, rather than having utility or a private company make our energy decisions for us, the city and the residents and businesses of the city are able to make these decisions. So we're able to dictate our energy future. It's also an opt-out program, which means that if you are a basic service customer of Eversource right now, you will be automatically enrolled in this program unless you choose to opt out of the program. Importantly, the program does not, there's no signing contracts or anything like that to be part of the program. You are free to opt into the program or opt out of the program at any time without penalty. And finally, the program is guided by a set of principles and values. These principles and values are up on our website. I've put a few down here in these green shaded boxes. So they are local electricity, renewable electricity, affordable rates, and stable rates are some of the pillars of this program. So this program is at the moment going to offer 3 products. And so from left to right, I've shown sort of in terms of increasing amount of renewable electricity that you'll receive through the program. On the leftmost side, we have the basic product. It's the cheapest product, and you get 18% renewable electricity when through this optional product. The middlemost product is the standard product or the default product, and it's called the default product because when you are automatically enrolled in the program, this is where you're placed. And from there you can opt into other options. But the standard product, you get 28% renewable electricity, and you pay about 11.4 cents per kilowatt hour. And then we also finally have our optional green 100% product. So you get 100% renewable electricity, and you pay a slight premium for that electricity. So these are the 3 products that the program is offering to businesses and residents. Now, I'm sure a lot of people are wondering, well, how does this compare to what Eversource, the utility, would provide? So here we've just done a side-by-side comparison of our standard product to Eversource basic service. And so you'll see that the standard product for the Community Choice Electricity Program offers 28% renewable content. With Eversource, you get 18% renewable energy content. And then you also, and this is important, you will pay a lower rate for the months of February to the end of June, July 1st. So we're only talking about this period. These are what the rates would be because Eversource's rates change twice a year. And so on July 1st, the Eversource rate is going to change. And therefore, this is one of the reasons why we can't promise savings because we don't know what future rates are going to be. But I wanted to show you just for this window of time from February, which February is when the program launches officially. So from February to the end of June, with CCE, you get more renewables at a cheaper rate. The program also supports local renewable energy. So the city has contracted with a solar developer to develop 100 megawatts of new solar within eastern Massachusetts. And 100 megawatts is a lot of electricity. So through this contract, low-income customers are going to benefit. We anticipate about 21,000 low-income customers joining the CCE program. And then the rest of us also benefit because we're supporting renewable electricity, renewable projects. But specifically, the low-income customers will receive at least a 1 cent per kilowatt hour discount, which might not sound like a lot, but over 20 years, that amounts to $28 million saved by low-income residents. And 1 cent out of the electric rate of 11 cents or about 11 cents. It's a big savings relative to what you pay on a per kilowatt hour basis. So, this is one of my last, second to last slide, I believe. So what won't change under CCE? many of the programs, plans, or other forms of assistance that residents receive will not change. That includes residential assisted discounts, budget billing. If you have solar on your roof and you benefit from net metering, that doesn't change. And if you are part of a green power supply program, this program doesn't affect that at all. It's entirely just the electricity supply part of your bill. So that's what I'm showing here on the right, and I'm showing a sample image or generalized image of an Eversource bill, highlighting what you would see come February when you join the program. This is where you would see the change under your electric supplier is. You would see billing for City of Boston CCE. And Eversource will continue to bill you. They'll continue to provide customer service, maintain the grid, and deliver your electricity. So that's what won't change under CCE. And then finally, I just want to mention that, now it's up to you to decide whether you want to participate in this program. As of yesterday, we sent out mailers to every eligible resident and business of Boston. So I think around 244,000 pieces of mail went out, looking something like this. I'm showing a picture of the envelope. In the envelope, we had a letter from the mayor. We had all this information about the program, the products, a language accessibility document, and an opt-out notice. And so if you don't want to be part of the program, you would fill that opt-out notice, opt-out reply card, and send it back to us, and then you will not be automatically enrolled in the program. But as hopefully I've demonstrated here, the program looks to do a lot of great things in terms of affordable rates, stable rates, and renewable energy. And so we hope that you'll join us, and I'm happy to answer any questions. So thank you.
Thank you, Aiden, for presenting to us. And forgive me if I missed this at the beginning of your presentation or at any point of your presentation. Is this eligible? Are the folks eligible homeowners, or is it for renters as well, or what? How does that work?
Yeah, so it's really anybody who has an electric account, right? If you have an electric account in your name, whether you're a homeowner or a renter, you get to decide where you want to get your electricity supply from. And so it just requires you to be a resident of Boston and that you have an electric account.
Okay, so we all should then be expecting those mailers, or are there other ways to sign up for the program?
Yeah, so so many people will receive a mailer, the last round of them went out yesterday. We also on the website, and I can drop the website in the chat. It's boston.gov/community choice electricity, the name of the program. So you can opt into the program. The only people who aren't going to get a letter in the mail are people who are not basic service customers of Eversource. So if you have, every basic service customer of Eversource will receive a letter. If you have signed a individual contract with a different supplier than Eversource, if you sign a contract, you aren't on that mailing list because you're not going to be automatically enrolled in the program. This notice was to go out to people who are going to be automatically enrolled.
Sure. And I know Wesley had a question as well.
Yes, I do. So, hello, Aiden. I am speaking to you through a sign language interpreter. So I first want to say thank you for your presentation. And I want confirmation that my wife and I got the letter. We got that mailer inviting us to sign up for that program. So I want to confirm that. Also, I would like to say that there was information on a welcome webinar on this program, and the schedule, I think there's one on next week on Thursday for the Community of Boston Energy Choice Program. So my two questions for you are, will you be there at the webinar? Will you be giving this same presentation? And if so, will there be captions or an ASL interpreter for us having access to that information during the webinar?
Yeah, thank you for that question. Yeah, and I did forget. Yeah, we are holding 11 webinars, 10 of which are going to be over the next week or so. So that's a great point. We really want to encourage folks to go to those webinars. I will be presenting something similar to this. It might be this presentation, but we're also going to have a lengthy Q&A where residents can ask questions. We are offering 2 webinars with live captioning, CART services, and 2 other webinars with ASL interpretation. So that's so you said you received the mailer. On the back side of that mailer had the schedule of all the webinars and what accessibility is being offered at each webinar. So we're trying to, and there'll be 10 languages as well that we're offering interpretation into. And I'm happy to drop that in the chat too, the link to those webinars.
Thank you very much.
Great, and I know Ducia had a question. At least one.
Yes, thank you, Jerry. Yes, again, I can just piggyback. Thank you so much, Aidan, for your presentation. While I was listening, there were indeed a few questions that came up, and you did answer a few of them when you were explaining to Kyle or somebody else here. Well, I'm wondering, you mentioned that it's for law, that you have a program for low-income individuals. Here's where I'm curious. I know that there are some people who are low-income, usually they have, I don't know, they may have full-time job, but sometimes they have part-time jobs. But what I'm wondering is, life happens, and some people who are on disability, they go to the point where they're not able to work for a while. Like, I don't know, for maybe 6 months to a year or so, depending on their situation, and then they have to go on disability. So I'm wondering, is there also a program for them? Or what if they suddenly cannot pay or something happens, and as I said, they can't work anymore and they are on disability? Is there, can they continue receiving this program, or is there a different way? What's the situation with that? That's my first question.
Yeah, thank you for that question. So in terms of the low income discount, the folks who receive that discount are customers who have already been pre-qualified by Eversource, the utility, as being low income. So Eversource has their own. There's I think a discount for low income customers through Eversource, and so what the city is doing is basically we are taking that list of the people that Eversource tells us are low income. Those would be the same people who, because they're already pre-qualified as low income, they would receive that low income discount. To your second question about, being unable to pay at any time, to be able to pay your electric bill, that's something that Eversource would handle. So I mentioned that Eversource has something called budget billing, and so my understanding of that is basically it's there for people who need a different payment schedule or who needs some sort of plan, and so that, like I said, would still be available to everyone, but it's Eversource that sort of handles that budget billing, as I understand it. So the program wouldn't really get involved in that.
Okay. And my last question is there also, like I saw the presentations, will it also be in different, different language accessible, like accessibility wise, like for everybody? Like I know there's some people who can read like the paper. Is there any way that so people could access the information different otherwise?
So you're asking, is the presentation going to be translated?
No, like this, like the budget, like all this information, like the budgeting, the program, like all the information. Is there also a way to make it more accessible, like whether language related, whether Braille or something like that?
Yeah. So the mailer, for example, that went out had a language accessibility document. It was in English, but there's a disclaimer that says that you should get this. This is important information. You should call this number to get it translated for you. So and the call centers that are up now have language accessibility in all different languages. So yeah, certainly the information is available in. We're doing the webinars in 10 languages. However, I think the call centers that that are up have, I think probably over 100 languages. So that's sort of how we're handling that. We also have, the websites that we have are you can get those. There's a button to translate the websites, so all that information is available. And we also are working on fact sheets for the program that would go up on our website, and those are going to be translated into 10 languages as well.
Thank you.
Thank you. I know Elizabeth had a question as well.
Thank you for the presentation and for a program such as this that does bring a different level of consumer choice. The quick clarification was that a correct understanding that the difference between the basic opting down versus standard is that it's slightly less, the per kilowatt is slightly less under the basic plan, but less renewable? Is that a correct understanding?
Yeah, so exactly. So we have the three products. We wanted to offer residents who maybe want to save money on their electricity bill an option where they can, informally it's called the opt-down option. So you opt down, you pay less, you receive less renewable electricity. And then we have, for people who can afford it or who want to receive more renewable electricity, we have the opt-up option, and then the default is right in the middle.
Okay. Are there any, it sounds like from the consumer point of view, the customer point of view, they shouldn't notice any difference in their electricity. Do you foresee any other transition issues as this comes on board?
Yeah, no, so it's, like I said, the transition should be pretty seamless. Eversource will continue to bill you. Nothing changes there. If there's a power outage or any kind of electrical issue, that's still the utility. That's still Eversource that handles that. Really, as I showed on this slide, the only thing that changes is your supplier, which is shown on that one part of your bill. And the city signed a contract with the supplier, Constellation, but the city will be going out to secure new contracts in the future. This program could last many years, sign contracts that are very long. So that's the only thing that would change is that supplier, but the customer is not going to really, that's not something that you as a customer need to it's not going to be a transition issue there. So
I just thought that was helpful to reiterate, so because naturally with people with the upcoming winter months and cold weather, that just so people have that assurance. But thank you.
And I know Olivia had at least one question.
I was wondering how this is going to work for Boston Housing Authority tenants who rent is actually, the electricity is included in the rent.
yeah, so I believe what you're referring to is what is called a master metering kind of situation where the electric account holder is not the tenant. It is like I said, it's rolled into ultimately what you pay, but you don't hold the electric account. So that is whether the decision is with the electric account holder whether they want to participate in the program or not. So it's a different situation, but they're the one, if they did receive a letter from the city, they're the one that would have received that letter because of being the electric account holder. So you may not have seen, if you are in a master metering kind of situation, that you would not have probably seen the letter.
Okay. Juan has a comment.
Yeah, thanks, Aidan, for all this information. I just wanted to comment the city of Boston because I also received mail where they are informing all the residents about how we can learn about who is our electricity supplier. I think that was really important because, as you know, there are some companies who are using very sneaky strategies to change who is your electric supplier. And I'm really glad that the city of Boston was on top of that, informing all the residents about how we can really check who is our electric suppliers. As Aidan was showing us in our slides that is there, we can really identify like that. But that kind of education is really important and can save a lot of money in the long run.
Yeah, thanks, Juan. This program is very much related to that issue that you raised about competitive, these electric suppliers, these private companies who send marketers to the doors of residents, and so one of the things this program is doing is providing sort of a this is a city program. This is a program you can trust, where you can feel good about where you get your electricity from. Like I said, with one of those suppliers, you have to sign a contract typically. A lot of those contracts have early termination fees, and they're very complicated. So, I just want to reiterate that there is no signing of any contract with this program. You are free to leave it, opt in or opt out at any time. And you can trust it because it's coming from the city. And yeah, if you don't think you received a letter, that might be a signal to you that maybe you are on a competitive electric supply contract with another company. And as I'm showing here on this slide, you wouldn't know that. You wouldn't necessarily know because you get your bill from Eversource. So you think, oh, my electricity comes from Eversource. But really, you have to look at that part of your bill where it says your electric supplier is blank, and that's going to signal to you who your supplier is. So it's just really important to check that out and see what your situation is.
Great. Well, do we have any other questions from members of the advisory board? Hearing none, do we have any questions from members of the public who may be attending the meeting? Hearing none. Again, thank you so much, Aidan, for your presentation. Definitely, it sounds like there's a lot of potential benefits. So I hope, those of us who do receive the mailer, go to one of the webinars and take advantage of the program. Thank you very much.
Thank you.
Next on the agenda, I should have said earlier before we went into Aidan's presentation that the October minutes are not ready yet, and they will be ready for the January meeting, and we will vote on those minutes, and I assume these minutes from the December meeting at January's meeting. But next on the agenda is my report, and I will keep my report very brief. What I wanted to bring up today was very much the MBTA. I'm sure everyone here has seen, on the news and especially with Mayor Walsh's press conference and presentation on Monday, going against the proposed service cuts that the MBTA is proposing due to their extreme budget shortfall. So I just wanted to encourage everyone who hasn't done so already. The official public comment period is over, but you can still contact the MBTA at public engagement at mbta.com and submit your comments in regards to the service cuts. And I will just say, as being a member of RTAG, the Riders Transportation Access Group, that we've been privileged to have, several different presentations on the forging ahead and on the proposed cuts, and the T has really pledged to maintain the vast majority of service impacting folks with disabilities, and I've been heartened by that. But with that said, there are still many stakeholders, many advocacy groups who are in opposition to any the proposed cuts that have been publicized so far. So again, that's why I would encourage anyone to avail themselves of contacting the T and participating in the Fiscal Management Control Board's meetings. They're on every Monday. I believe they're voting on the proposed changes at the end of December. Don't hold me to that, but you can find out more information on how to participate in those meetings on the MBTA website. So So with that, we can move on to the commissioner's report.
Thank you, Jerry, and welcome everybody to our last meeting of 2020. I wanted to start the meeting with a salute to John Winsky. As you've all heard, John passed away a few weeks ago, and he was one of the original founding members of our board, along with Carl Richardson and a small number of other dedicated advocates. So I wanted to take a moment to talk about his memory, honor his memory, and talk about his hard work in the city of Boston. John was an unstoppable force for advocacy for years in Boston. He was one of the original founders of the DPC after Bill Weld tried to consolidate all the disability agencies into one big agency. So it started out with just a group of ad hoc advocates. They formed the DPC over 20 years ago, and they do incredible work. John also helped with the Beacon Hill issues we had when we were trying to gain access to the sidewalks. He was instrumental in sitting with me and Mayor Menino and then Mayor Walsh to convince the residents of Beacon Hill that access was important. And I feel like I really wouldn't have won that battle without John. So I want to just thank John. I owe him a debt of gratitude. I want to appreciate his work and his memory. And luckily for us, John passed the torch before he passed away. So he left the DPC in very good hands, and he left our board in very good hands with all of you. So with that, we will carry on in his name, and I can begin my report. Thank you, Jessica. So following up on information about the advisory board, as you know, we have 2 open slots we're working to fill. We got 16 applications, some not from Boston residents, and you have to be a Boston resident in order to be appointed. So we may open it back up probably after the new year because people are busy now with holidays, but we'd like to try to get some more people to apply. So if anybody knows anybody who's interested, either someone with a disability or a close family member of a disability, we'd love to have them apply. Likely the appointments won't happen until 2021 anyway, so we have some time, but please spread the word. And so I don't know if everybody gets our newsletter. If you don't, you should sign up for it. But we send out a weekly newsletter. Chris Morawski in our office works on it. He works very hard to get all the latest information in the newsletter. And this week there was several updates on financial assistance available to people during COVID. There was information on rental relief. The city still has a rental relief program for people who can't meet their bills. There are home repair programs through D&D, Department of Neighborhood Development. There are senior housing programs for anyone you know or anyone who's over 60. They can get help with heating and replacing heating equipment. And then there's also, it was just announced yesterday that the city has a charitable trust that they work with, and they distribute grants of up to $2,000 per person. It's a one-time grant, and it can only be used for very specific things like rent or utilities that are overdue. But it can be a great stopgap measure if someone runs into a hard time because of COVID, whether they lost work or a spouse or another person of their household lost work. It can really help to keep people in their homes and safe and fed. So look up the newsletter. If you don't get it, let us know. We'll sign you up. But there's more information on that. And I would really appreciate it if you spread this information to the community because it's so important right now, especially as we move into winter. So a couple of other things that we're working on in the office. We are going to create what we're calling COVID care packages and mail them out to Boston residents with disabilities. The COVID care packages are going to contain a resource booklet that has information on all kinds of topics to help people make it through this pandemic. Things like COVID testing and treatment when the vaccine comes. Well, we may include that. We probably won't include the vaccine, so I'll skip that. But ways to prevent COVID and where to get tested, and the latest information on where you can find out about shutdowns and staying safe and things like that. And then we'll have a page on housing resources, whether it's rental relief or home repair, or if you're looking for housing, or if you've become homeless. We'll have pages on technology and how to access the city programs through the web. We'll have phone numbers. We'll have all kinds of information to help people with disabilities make it through the next few months. We're also going to include a mask with the city logo on it, so people can, it will be reusable, so people can have that if they have to leave the house for any reason. We really want everyone to stay safe, so we're looking at enclosing also some hand sanitizer or some hand wipes. And we're going to send the care packages out to several thousand residents, most likely people who have accessible parking spaces, because we know their addresses, but we may look to also identify other sources of residents with disabilities. Another thing we're working on this season in the office is clear masks for people who are deaf or use facial cues to communicate. So we recently, actually this afternoon, we got a delivery of masks. I believe Jessica is going to model it for us.
For everyone's viewing pleasure. The light glare isn't great, but you know, here we are.
Right. We were saying it might look a little awkward at first, but like everything else we're getting used to, I think it will quickly become normalized, especially as people start to wear them out in the community. So we're going to work on distributing them to frontline City Hall staff, people who deal with the public, like maybe parking clerks or greeters in City Hall, who can communicate with residents. And we're also going to be able to support community members who may need them. We're going to prioritize city staff first, and then we'll move on to the community. But they're also available for sale now at the Boston Lyric Opera, and we can send you information on that after the meeting. What else? A few other things we're working on. We continue to work on systemic access, which is improving access all across the city in every department and the work that they do. You may have read earlier this week that the city has announced they extended their outdoor dining program through 2021. So all the restaurants that brought the seating outside into the street or sidewalk are able to continue that throughout next year. So we worked really hard with the Boston Licensing Board, with the other departments, with the mayor's office, with Health and Human Services, and with the Architectural Access Board to purchase and distribute 90 ramps to restaurants to create access for on-street dining. So we've taken a pause now in distributing ramps because of the holidays, and the indoor dining has been shut down now for the rest of the winter. But we will be back at it in the spring, distributing the rest of our ramps. We still have about 90 to go. So when you get back out, if you go out to eat, please keep us informed of any restaurants that may need a ramp, because they're no cost and they're easy to set up, and they will continue to provide access for people with disabilities. Another thing that was announced just today is that the city just, Mayor Walsh and the City Council both supported and was approved today an affirmative housing requirement for the Boston zoning code. And what that means is it's a number of requirements, roughly around 100 new requirements, and they are all for inclusion in housing. They're to keep people housed, to put in place protections so people can't just be evicted. And one of the things that has been codified as part of this package is our accessibility checklist that we work on with BPDA. So Olivia is raising her arms in victory. So it is a very big victory. So now this will be codified. So before it was a request by us and the BPDA, but now it will be a requirement. So housing won't actually get approved unless they fill out this checklist. So it's very exciting for us. We've done a lot of hard work on the checklist over the years, and we're hoping it will really improve accessibility of the housing stock in the city. And then I just wanted to bring up a few emerging issues. I'm sure you all know that COVID is resurging, and the governor has announced rollbacks. So I just want to implore everybody to stay safe. We know hospitals are getting crowded again, and we don't want to see end up there. So please, our message is always wear your masks, keep your social distance, try not to go to any large gatherings, and just keep up with the hand sanitizer and the good hygiene, especially during the holidays. We know it can be really difficult, but we have to get through this season with everybody safe and healthy. And on that note, we have been having meetings internally with city agencies about the rollout of the vaccine. And one thing that we want to do is we want to get the feelings from people with disabilities about how they feel about taking the vaccine. Because I know a lot of communities have mistrust of medical interventions, particularly vaccines, because of past medical abuses and injustices that have been done to different communities. So the Boston Public Health Commission is setting up a series of focus groups, and they're also going to be giving out a survey. So as soon as I get that information, I will pass it along to all of you to distribute to your friends, anyone you know with a disability, because we really want to make sure we get the right messaging out, that the vaccine is safe, that it's tested, that people with disabilities should be thinking about getting vaccinated. And we want to make sure that everybody has the right information so they're not misunderstanding what the vaccine is. So that's going to be a very long-term project because if you heard the governor's announcement today, he rolled out the order of groups who are going to be getting the vaccine, the time frame. And it seems like people with disabilities will be captured in the second round primarily. People with comorbidity will come in phase 2, which I believe is February. So as we get more information on the vaccine, we will have more information to share. One thing I do know is that the city of Boston will not have control over any of the distribution of the first round. We may be given vaccines to administer to people, like the hospitals will be giving them, but the city administration does not have any say in the first round about who gets them. It's all coming from the federal government. So we want to make sure people aren't upset, they don't feel like they're being left out. And believe me, I'm always advocating for our community. So as soon as people with disabilities can get the vaccine, we will get it. So, stay tuned for more information on that. And then I have some other things to wrap up, but I figured I could stop here and take questions or comments. I know I gave you a ton of information, but I'm happy to elaborate on anything that anyone wants more info on.
Here, Lucia, I just have a question. Can you hear me? Or? Okay.
Yes.
Yeah. Okay. Just want to make sure. Yeah. I was just when you were talking about the restaurant, and so this is where I'm confused. I know that we're back to stage 1, and at the same time, it's still possible to get. I know that they are taking a break from the brands because of the holidays, but how are people still able to go just to get takeout or eat outside? That's the part that's confusing me.
Yeah, the COVID regulations keep changing, so they are very confusing. But I believe that it didn't go back to phase 1. I think it went back to phase 3, step 1. And what that means is restaurants are still open, but they changed the requirements to be that you have to wear a mask at all times unless you're actively eating or drinking. It used to be that when you sat down, you could take your mask off. You could have it off when you ordered or while you were waiting to pay, but now you have to have your mask on for all of those things. And they've also, I believe they've limited the capacity again to a certain percentage. But the RAMP program, that is only for outdoor dining, and all the outdoor dining is closed right now for the rest of the year. And it won't open up again until the spring. We don't have a date on that, but as soon as the restaurants open, we will have the ramps available to people. So whatever access that everybody has, people with disabilities will have. But you should stay informed of the latest updates on COVID. You can go to mass.gov, and right on the homepage, it says latest COVID updates. And the governor has a press conference almost every day. So you can get to that right from the front page of the website too. So I'd recommend using that to stay updated because it is always changing and it's very confusing.
Commissioner, I'd just like to add one piece. So the governor, you're correct, the governor moved back to phase 3, step 1. I just want to note that in Boston, we never moved forward to step 2. So actually for Boston, that doesn't change anything for the regulations specifically, other than hospitals. So all of our gathering and restaurant restrictions and capacity restrictions within the city of Boston have stayed the same.
Good point. Yep.
Yes, and in terms of the, this is Jerry, in terms of what the governor's regulations said, just for clarification purposes, indoor dining will be limited to six people at a table or less, and I believe the capacity for most indoor activities would be 40% of the facility's capacity. So those are just a couple points of clarification. And I know Elizabeth had a question for you, Commissioner.
Sure.
Yes, thanks. Well, that is welcome news about the accessibility checklist. Thanks for having that implemented. I did want to follow up about the vaccine that I today learned from a health professional, an occupational therapist, that I was aware of people's suspicion, the historical mistreatment of some groups, or that this was put through too quickly. One I was not aware of. Apparently on the web there's also different conspiracy theories about there's a microchip in the vaccine or things that, and although the information isn't intended to be chasing down every theory, just trying to overcome each and every point that's made against it. But as part of safety, I frankly hadn't even heard that there was that kind of rampant disinformation out there. So I think having this source of credible information and encouragement, and even I don't know if the materials also include that there should be an expectation that there are some side effects, but that they're short term and risk benefit that about the worthwhileness of going forward.
Yeah, we'll be pushing out all the information we get from the Boston Public Health Commission, and they work with people on the national level, and they have the expertise that we don't have. So we certainly will push out all the information they give us, and it's available in multiple languages. And like I said, it would be great if some of you could participate in the focus groups, and if not, at least to fill out the survey, because some people just don't believe in vaccines, and then some people may believe in conspiracy theories, and some people may just think it's rushed. So we want to know what information we can get to what groups that will help encourage people to take the vaccine so they can stay safe.
Sure, and I just thought for the purposes also, since we all have networks or people in our own communities, just to realize that that there is even a different angle of some of the hesitation or questions by some people.
Yeah, I had actually heard that one about the microchip.
Maybe we can have somebody from the Public Health Commission come to one of our early board meetings next year.
Yeah, that's a great idea, because we'll have a lot more information on the vaccine by then.
I think that would be great, or even a forum or something that folks can participate in to get the latest information about the vaccine. I know your office, Commissioner, will work on getting information out, but again, anything that we can do to help with that would be great. So
yeah, absolutely.
I think that's an excellent idea, Jerry, and especially for people with disabilities.
Commissioner, I had a question because I was recently tested for the virus, and it was difficult accessing the test. And I did see on the news recently, within the last few weeks, an ambulance company on the North Shore just on their own decided to offer kind of a mobile testing van for vulnerable populations. Has that been something that the city has explored at all, or is that something that we could possibly explore?
Yeah, that has definitely come up in meetings, the idea of taking the testing out to people, to different, like potentially senior buildings or disability housing, or even on one-on-one cases, but we haven't come up with a process to do that yet, but we have talked about it. So I would say to stay tuned for more information.
Okay, and if we can help in any way with that, I think that would be an important service, because along with the vaccine, I think, testing along with the social distancing is still going to be a very, very important piece, particularly in the early part of 2021, until a large percentage of the population has an opportunity to get vaccinated. So.
Yeah, but the city puts a lot of effort and time into the free testing sites.
Sure.
And they do change communities. So we encourage everybody, they're free and they're well publicized. So if anyone is worried about the cost, or anyone feels the inclination to get tested, please, if you don't know where they are, you can check on boston.gov, or you can reach out to us. You can basically get tested any day of the week in somewhere in Boston.
Sure. And I know Elizabeth has a follow-up question.
Sure.
Oh, she's on mute.
Hi.
There you go.
Yes, to that point, Jerry, I don't know if there were other particulars about your experience that might be helpful, but I think for a lot of people who have, say, mobility issues or where waiting in a car or waiting in a long line isn't really going to be a workable situation. I mean, imagine in the city, there are situations where it's walk-in, but if it's there are some situations where someone might not be in a good position to wait a lengthy amount of time. I don't know if you could tell us a little bit more about that experience, or ways that they're trying to.
Yeah, I mean, I didn't want to take up too much time to talk about the specifics, but it was, I did access a free site that I'd actually been tested at once before. They didn't have a very quick, they didn't have appointments available. And so they encouraged me to go through my provider, and then my provider was directing me to a drive-through site. And because of my use of the ride or other transportation, a drive-through site really isn't workable. So I had to really do a lot of advocacy for myself to get an in-person appointment to get the test. So, which I was able to do, but again, it took a little bit of effort on my part to do that. So.
That's helpful information. Thank you, Jerry.
Yeah. So, any other questions for the commissioner? Hearing none, I guess we can end your formal report, Commissioner. Thank you. I do see on the agenda, though, that there was a spot for upcoming events and announcements. Did you handle most of those under your report?
We just had a few. There's a public meeting on Ryan Playground. It's in Boston, and that public meeting is Thursday night, tomorrow night, at 6 p.m. And we can put the information in the chat. Jessica's going to do that right now. And the city's doing a lot of work on their parks. Boston Commons undergoing a master plan. They're doing a lot of work in Franklin Park. So I would encourage people to weigh in if you're interested in that, because they really listen to community input. And sometimes it's helpful if we give them input from our department, but they also get it from the community. So, we'd be happy to explain things to you if they're confusing, or, help you give feedback on any projects you're interested in. So Jessica just put that in the chat. And the other meeting I wanted to mention is also tomorrow. And it's a meeting, it's being held by Mass Health, and it's a listening session on EVV. For anyone who has PCAs, there's going to be a new policy implemented in 2022, which is called electronic visiting verification. So whenever a PCA comes to somebody's house, they have to app in, and then when they leave, they have to app out. So there are a lot of concerns about privacy and tracking for people with disabilities and PCAs, because a lot of PCAs are from underserved communities and don't have trust in being tracked. And, you can't blame anybody for not wanting to be tracked. So it is a federal requirement, unfortunately, but we're trying to work with Mass Health to make it as the least impactful as possible, so we don't disrupt the PCA system. So that meeting is tomorrow, and I'm not sure of the time, but we can find it out and send an email if anybody's interested.
There'll be several more throughout next year. Is that correct,
There
Commissioner?
will, yeah. There's one scheduled in January too, I believe.
Great. Yeah, I do know that a lot of folks with disabilities and PCAs have concerns about that, but this was, as the commissioner said, it was something that was passed. Actually, I believe when the Affordable Care Act passed, it was part of that original legislation. So it's not something that Massachusetts has much control about, although I do know that it's been put off a couple of different times. So
and one thing to be aware of with these meetings is they're definitely listening sessions. So Mass Health won't be answering any questions. They're just taking input. So just be prepped for that, because some people had expressed frustration that they had all these questions that weren't being answered. And Mass Health is stressing that that's not the point of the meetings. They want to get input so they hear what the concerns are as they craft the program, because it hasn't been decided yet. It's still in the making.
Yeah, I remember this project was discussed, I think, last year or the year before. And there was already, because there was so much outcry against that app, I think they put it on hold. And especially there were technological issues, like if you were, let's say if you were in Boston and the app was saying that you were in some completely different place, and they said, okay, this is not going to work for anybody. They're going to, even if you are checking in that you're going to work, for some reason due to technical issues, the app showed you in a totally different place. So that was one of the also, so I remember they just put it on hold, but I guess they still want it.
There's also a certain amount of privilege involved in EVV as well. It's understood that you have internet access, and not everyone has internet access or can afford internet access.
Yeah, and that's, like you said, it's the privilege of having it in your home. A lot of people may be able to access it at a community center or a senior center or public Wi-Fi, but a lot of people still don't have it in their homes.
Yep.
And may not have a smartphone or a computer.
Exactly.
So it's important, anyone who's interested, go to the sessions and speak out about it. And that's all the announcements and events I have.
Okay, great. Thank you, Commissioner. And I know next on the agenda was old business, and an update on any outstanding issues. I can think of a couple, one being the possible ordinance regarding open captioning, and also the information around the city hall renovation project. So those are a couple of outstanding issues that I can think of.
That's interesting because those are the first two items on my list.
Great.
So we're on the same page.
And I
So
was gonna bring those up.
So as far as the ordinance for captions, we met with the law department and they gave us the go-ahead to write up the ordinance, a draft of the ordinance, and propose it to IGR, which is the Intergovernmental Relations Office. And we actually have the draft ready, but our contact in IGR, IGR is the department that works with city council and state agencies and federal agencies because we are strictly employees of the mayor. We serve the mayor and the city, and that's very separate in City Hall from city council. So we can't directly communicate with city council or with state legislators, things like that. We have to go through this office. So our wonderful contact in IGR who dealt with the city government, he changed positions. So he's no longer in IGR, so we will have to follow up with the new person. And to be honest, this work will probably happen after the first of the year, but I don't want anybody to think it's been dropped because it certainly hasn't. And we will make it a priority to ramp it up after the holidays. And what will happen once IGR approves the draft proposal is that City Council calls for a hearing or a meeting on it, and then the public gets to weigh in. So that will be an opportunity for people to speak up about it. And I'm not sure if I reported this already, but I did reach out to some other cities who have it in place, and none of them have heard many complaints. There was like 1 or 2 complaints I found online, but they weren't super impactful to people. They were more like kind of expressing a mild annoyance at seeing the words on the screen all the time. And some people had requested just to have captions on only TVs in the establishments. So we're going to propose the draft that I shared with you, which would cover all TVs in establishments in public places. And we'll go from there. I mean, if people have objections, they can come to the hearing and speak out. And then it's really up to the city council and the mayor to read it, understand it, listen to comments, and make the decision. So Wesley, thank you again for raising this. And please don't feel like it was dropped because it has been delayed. And that's just a byproduct of the fact that we're working on a lot of things.
Totally understandable.
And just so we can clarify the process, Commissioner, basically it will go before the city council, but prior to that, they'll schedule a public hearing, correct?
Yep, they usually, what they do is they schedule a public hearing in city council with the councilors in attendance. Mm-hmm. And I may present on it, present the facts on it. The law department might be there, and then we'll just present what we want to do. And then people can sign up to speak out about it, whether in favor or against it. And then the city council takes that information and reads the documents over, the proposal over, and then they'll make a decision. I don't believe they vote on it at the first meeting. They will take it back and digest it a little bit and then call for a vote at a later date. So it is a somewhat lengthy process anyway, but that's okay because we have it started and we'll keep pushing for it. We'll keep moving forward.
Sure.
And
do we need a sponsor, like one of the councilors to sponsor it, or no?
Our first step is to go through IGR, and they can let us know. You do usually get support from one or more councilors, and I have a few in mind who I believe would support it.
Yeah, well, I know Councilor Flynn has been very supportive of your work and of the advisory board in the past. So.
Yep. He identifies as a disabled vet, so he's very supportive of our issues. So, yeah.
And Carl has his hand raised.
I finally figured out how to raise my hand. So I also wanted to, as a result of the good work that the commission has done, I was speaking to a senator at the State House and told him about that we were doing this, knowing that he has deaf members in his family. And he was so excited, he told his deaf daughter about it. And now he wants to submit a bill to make it statewide.
That's
So
awesome.
and he's now looking into whether or not, so I've had a few meetings with him and his staff, Senator Michael Barrett, and we're looking into whether a bill will be submitted next session to consider the possibility of making this a statewide mandate.
That's great.
Yeah, and several states have done that. Some are on the state level and some are on the city level. But I think our thinking was, and the law department's thinking was, it might be able to happen more quickly at a city level because the state has more to research, more people to reach out to. You know, the whole state is a larger
Absolutely.
area. So
You guys will do it quicker.
yeah, we'll keep moving forward. But then if the state does it, all the better.
Great.
Were there any other questions on that or comments?
Elizabeth has a question.
Yeah, that's great to hear that it's moving forward. Can you just remind us, does that include also statistics on people who are hard of hearing? Because since that is even a larger percentage of people who would benefit, not to mention if people want to foresee a new normal down the road, that in many restaurant, bar settings, in certain settings, just the ambient noise, it can be beneficial to anyone who wants to hear what's happening on the TV. But can you just remind me about that?
Yes, anytime really that we advocate for anything for people who are deaf, we always include people who are hard of hearing and also seniors who lose their hearing with age. And in the draft, if you go back and read it, and I can resend it, we in a very detailed way, we laid out all the people that this would impact and affect. And that's the really good thing about disability accessibility changes that are made, is that people don't realize it, but they help everybody. Like we see that with curb ramps. Like we get baby carriages and luggage and things like that. We see it with concrete sidewalks. Everybody can use them. And certainly we'll see it with captains. And the great thing is it will help people who didn't even know they needed this service. You know, like you said, sometimes people just tune out and think they can't participate in a TV program because they can't hear it. But now if there are captions, it will just, it will kind of, inspire people to pay attention more and, enjoy TV even.
Yeah, thanks, because I thought you had, but I think it just always is helpful for people to be aware of that, including, as we've both discussed, the ambient noise. But I don't know if there were any other questions, but you also were going to, Jerry had mentioned about an update about the City Hall Plaza renovation.
Yep, just one final comment on the captions ordinance, somewhat related. Wesley had also asked about the Horace Mann School. You may know that building is closing down. So we did identify a contact in the Boston Public School to reach out to for information about the temporary move and then where the school will end up as a permanent home. So I have not made contact with that person yet, but we believe he's the right person to speak to about this. So I will be following up on that also. So thank you, Wesley. You alone have done so much advocacy this year for people with disabilities, and we're getting stuff done. We have the clear masks, so we thought you'd be happy about that. So we are making progress.
I just wanted to note, Commissioner, we reached out to the BPS contact today.
Oh, great. Excellent.
Yes, thank you so much to Carl and for Wesley for all their advocacy efforts this year, and thank you to everyone for all your hard work this year. I really, really appreciate that, and I know the Commissioner's office really appreciates the Commissioner and her staff really appreciates it, and once again, let's thank the Commissioner for all her efforts, particularly around the pandemic for people with disabilities as well. So thank you for that.
Sure. And then an update on City Hall Plaza. So I had a conversation with Chief Brophy, and he is still very much supportive of the agreement. He's working now with all the city departments that are going to benefit from these changes on the plaza, like the city department that handles like entertainment and tourism, our office with the improved access, and every other department that has a direct connection to the improvements. So what he wants to do is highlight the work that's happening along the way to prepare people for the changes and keep them updated and motivated, because it's going to be a long project. You know, it's going to be well over another year before it's completed. So we want to keep people in the loop and make sure they know what's happening. So he is going to do some highlighting of accessibility improvements in the next month or so. So at his suggestion, he said that we could also highlight the fact that we're doing an agreement with the Disability Commission Advisory Board to ensure that the access remains in place. So he is still fully committed. We also spoke with the law department about it, and their feeling is that it would make the most sense to have this agreement go into effect when the work is done, because then it will be, I believe, the board expressed a desire to have it revisited a year from when the work is initially done. So we do still have some time to write up the agreement, and we will work on that, in the new year, but we haven't actually written the agreement yet. But we will have some language, like I said, in the press releases that go out about accessibility. They should be going out sometime in January, so we can talk a little bit more about it. We can highlight it. We're still committed to it, but we just haven't actually worked with the law department to write it yet. And our contact in the law department will be going on leave for a few weeks. So when he gets back, he will put us on the calendar to move forward with it.
Remind us, Commissioner, when's the first phase supposed to be completed?
I am not sure about that.
Okay.
Does any of my staff know? Jessica, Patricia, Sarah? If you do.
I believe it's a while. I know that's not a specific time.
Like a year?
I think
Something
at
like
least
that?
a year.
Okay.
But they are working steadily on it, so it will happen.
Yes, it pops up on the news every once in a while, so.
Yeah, that's exactly what they want to do. They want to keep it in the news.
Could I ask another question?
Go ahead, Elizabeth.
I, for instance, would have interest in the language that did you call it the law department?
Yep.
That what actually is put on paper or at the agreement level, to just see what the written language is, because I mean, certainly Chief Brophy made it clear that there is a commitment, but I think it's always helpful to see, what's written what's at the written level, and with possible interpretations, so that no matter who may be overseeing it at any point, that it's encompasses what we discussed.
Yeah, absolutely. We can share a draft with the board because it's the agreement with the board. So before it's finalized, we will definitely work on it together. And Chief Brophy also mentioned he may want some quotes from people for the press releases. So I will reach out to board members if anyone would like to share a quote or two.
Okay.
And on a related note for old business, that reminds me that although it's at a much earlier point, when you're talking about the Boston Public Library, the BPL, and I'm trying to, Commissioner, you might have to help me paraphrase this in a better way, but once again, in a situation where the board would like to avoid a situation like City Hall Plaza, where we were brought in at the 11th hour for any input, that there was talk about whether we could have an update on any potential design at an earlier point in the process. And although I think you had said you would run it by them, or what did the architects think, but I think our advocacy needs to be not necessarily at the choosing of what, Because I would think if I were on the architecture, the project side of it, the further you can get uninterrupted, the better. And yet it's at the design phase when, if there need modifications or other considerations, it's most helpful.
Yes, and I did work with the library a month or so ago. They have a community advisory committee that they're working with, and they did ask for a representative from the disability community. So I gave them a name of a former member of the Architectural Access Board, Carol Steinberg. So she is serving on the advisory committee. So she will be in all those meetings, offering her expertise as well as her lived experience. So there is community input happening, but I will certainly see if they can do a presentation to the board. We can put that on our list of things to follow up for in the new year. And they'll have to let us know when they're ready, but I agree, it should be earlier rather than later.
Yeah, well, she'll be an excellent representative, but since the board, we across the board draw from different types of lived experience, I think that would be very helpful and important. Thanks.
Absolutely, yep. And that's all I have, I believe, for emerging concerns or old business. Sorry.
Okay. And under new business, I know that there's a heading looking ahead to 2021. So Commissioner, do you and your office have some stuff that you want us to be aware of for 2021?
I think I pretty much covered it. It would be the vaccine and focus groups. It was agenda items, but I think we have 2 or 3 now that we talked about. And then also the meeting schedule, which Jessica mentioned before we started, which we'll have to wait till January to get our firm schedule, but we should be able to get a January date, hopefully in the next couple weeks.
Sure, and I know that we should in the first meeting in January, we should talk about elections again. Because I've certainly enjoyed my time as chair, but I would also want to encourage and see other folks take on that role as well. So if anybody's interested, in having a leadership role within the advisory board, they can reach out to the commissioner's office or myself.
Well, it goes through a nomination process. We have to come up with a nomination committee.
Right.
And then put nominations in.
Right.
Yeah, and hopefully we'll have 2 new board members in the new year. So we'll have more people to carry out this work.
Great.
Jerry, I have some new business to bring up, which I just found out about this week.
All right, no problem, Carl. Go right ahead.
So on the governor's desk, as we speak, it just passed the House and Senate as part of the police reform bill. In the bill snuck in was a bill to start a new commission on the status of people with disabilities. And 7 people would be appointed by the governor, 3 people by the Speaker of the House, 3 people by the Senate President, 1 by the minority leader of each the House and Senate, 1 by the Attorney General's office, 1 by DPC, and a few other disability organizations. And they would do studies on how disabilities impact transportation. There is some language in there about them working with the Commission on Disabilities, which is why I bring it up. So I don't know whether the governor is going to sign this bill, but we will know within the next week. And I just sent the text and language of this bill to Kristen and Jessica so they can look at it and be aware of it and share it with the rest of the commission. So,
yeah, I'd be curious. So, Carl, it's just a commission. It's a commission of people with disabilities to look into,
I don't know if it's all of. I mean, there is language in there about trying to do diversity and put people with disabilities on the board.
Okay.
But to be honest, for instance, 8 people from the House and Senate from the State House are going to be picked. As much as I'm trying, we don't have a lot of people with disabilities in the State House.
So it'll be legislators then?
No, it'll be whoever they pick.
Okay.
They can pick it'll be legislators, community folk, governors, people, and an executive director with staff. It looks like there's even language in there for an executive director and the potential hiring staff. I don't know all the details. I'm surprised this got by me. I just found out, I'm not on as much as on top of things as I used to be because of COVID. I'm at home and something slipped by me. And they had some emergency meetings last week and this got snuck in with the police reform bill. So I am just now starting to do research and find out about it. But I just wanted to publicly, it's on the governor's desk now, which means it passed the House and Senate last week. And he either has to veto it, sign it, or not do anything. So I will be following up and I will let Commissioner McCosh's office know and the group know.
Yeah, well, maybe Commissioner, you can share that, share the legislation with all of us. I'd be curious.
I can send it out to all of us when I get off the phone. I'll send it out to all of us.
Great. Thanks, Carl.
Great, thanks, Carl.
Jerry, I'm unmuted. This is Paul on the phone.
Hey, Paul.
I tried to make my introduction, but apparently was cut off. Paul Karen, West End board member. I just wanted to say that on the election note, a good friend of disability, Alexander Gray, has announced his candidacy for at-large city council, City of Boston. If you guys ever want to go on his website and look, I know Commissioner McCosh is friendly with Alex, done a lot of advocacy work with him, but he has announced his candidacy in the next general election for city council.
Where's he from?
He lives in JP now, and it's an at-large seat.
Okay.
He's a good man. He started out before he worked.
He's an attorney when he was yes. Go on, Carl.
He worked at the State House before he went on to doing policy for the governor's office, A&F, before he went on to City Hall.
He's been a great colleague and also asset to the administration. His advocacy work and policy work is second to none.
Paul, does he still work for the city?
I'm not sure during his campaign how that goes, but you might want to just either give him a call or everyone's welcome to check out his website and go on his mailing list.
Thank you for that information, Paul.
Thank you.
You're welcome.
Any other new business? Do we have a motion to adjourn?
I've been waiting to make this for 2 hours. I make a motion to adjourn.
No, you haven't, Carl. You just brought up something. No, you haven't been waiting to adjourn for 2 hours.
Ask Jessica.
Jerry, do you want to just ask if there's any public comment?
Oh yes, I'm sorry, especially because of Zoom. The public comment. Is there any other questions or comments from members of the public before we adjourn? Hearing none. And again, do we have a motion to adjourn?
I make a motion.
Carl and Kyle seconds. All in favor?
Aye.
Aye.
Merry Christmas. Happy holidays.
Happy holidays.
Happy holidays.
Have a great holiday.